The meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's 1 in 31, but in some areas it's much worse than that, if you can believe it, 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California, where they have for some reason, a more severe problem. But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys, 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them, this is what we have to find out. Because when you go from 20,000 to 10,000 and then you go to 12, there's something artificial. They're taking something.
I think first and foremost, everyone feels compassion and understanding towards the families that have family members who are impacted by autism, and the desire for there to be an answer as to why it's happening, and also the need for effective treatment. The challenge for these societies that include Society for Maternal Fetal Medicine and other major organizations that take care of pregnant women is the fact that the current state of those studies do not establish causation. If you look at most of the studies that have been studied, most did not find any correlation or association between autism and Tylenol use. There are some that did find an association, and the authors were very careful about saying that it does not prove causation. And just to give you an idea about that, in those studies, they may have found that people who took Tylenol, in those studies, they may have found that the people who gave birth to a child with autism were more likely to have reported that they took Tylenol during the pregnancy. But there's a lot of weaknesses in that data, in that some of them didn't correct for one of the most common and most well-established risk factors for autism, which is a family history of it. And so that the studies where they did actually take into account looking at the siblings, they did not find an association. So all of this is to say that there are studies that show an association, some that do not, and that everyone really is frustrated because we want answers.
First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that, acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
I think it's important for everyone to know that there are very few medications that are approved for use in pregnancy, and Tylenol is one of them. The allegation of the association between autism and Tylenol, it has been studied for quite some time now, and again, no concrete evidence for causality has been established. There are warnings about chronic daily use that is related to liver failure, but again, that is a rare occurrence. most pregnant women are using it because there was a condition that required it. Most people are not using it when they don't need it.
So I think you shouldn't take it, and you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire, and you shouldn't give the child the Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you have to, if you can't tough it out, if there's a problem, you're going to end up doing it. Ideally, a woman won't take Tylenol. And on the vaccines, it would be good instead of one visit where they pump the baby loaded up with stuff. You'll do it over a period of 4 times or 5 times. The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms. This gives hope to the many parents with autistic children that it may be possible to improve their lives. That's one of the things that I'm very, very happy about.
I think the challenge for people is the fact that a lot of the earlier studies did not find an association, but people kept looking and they kept asking the question in different ways. Again, if you go back to the studies that are better designed, that take into account a lot of the challenges when you're studying something, those did not find an association. Just to give you an example, one of them is something called recall bias, right? So if you say to me, did you take Tylenol in pregnancy and everything is fine with my children, I won't remember. I'll say, sure, no, I didn't. Or, I barely took it. But if you have, an outcome and you're trying to find an explanation, you may recall things in a different way. That's scientifically proven that that happens all the time. I think the first thing you need to look at is that over time, for a lot of conditions, we have become better with defining the conditions and then increasing resources and accessibility to patients and parents for diagnosis. And so if you're screening for something and you have a better definition of a condition, you are going to see an increase in the diagnosis of that condition. So that is true. But even still, people do believe that the prevalence is increasing. We do not have a clear answer as to what those other factors could be. People have implicated everything from dietary intake during pregnancy to environmental factors to toxins in our food and water, to also, as I stated before, genetics, which is probably the area where we do have more clear evidence. What is not clear is also whether the causes of autism differ by the subtype. Are there, certainly in some of the studies, they do describe certain characteristics that you can see with autism spectrum disorder, and it really is what they say, a spectrum, where you see some that are mildly affected and some that are more severely affected. And are those different conditions, or are they the same? Do they have the same cause? All of these are questions that we don't have answers to.